Hi, I'm Dr. Mohan Thomas. Today I said to myself, what could probably bother people during these times? We're washing our hands 100 times, sanitizing it usually with some alcohol products. Then we're wearing this mask. Acne is a real nuisance for everybody, particularly the people that are most the age group that's more prone to it, puberty, pre-puberty, and even sometimes into their early 20s and late 20s. Now, if you have a history of acne, the smartest initiative is one, to wash your face as often as you can. If you have eruptions that are severe, there are many stages of acne: grade 1, grade 2, grade 3, and grade 4. Now, the time is too short to educate you about the different kinds of stuff. But if they become like big balls and pus balls and they're all over the place, a cluster of them, then I'm afraid that the best advice I can give you is seek a professional, a doctor who can advise you as to what you should do. Antibiotics should not be mentioned just like that in a video. It's not fair to you or to me, and probably is not part of good medicine. Now, but certainly what you can do is take the grease off your face, because the bug or the bacteria is called P. acne, grows in the small so-called open pores where there's oil stuck up in there. So it promotes more acne activity. So clean your face as often as you can. You can use a mild astringent, toner. Some companies call them as clarifying lotions. You dab them in the T zones, here, and just basically at the T zone, T and the cheeks, and just wherever you're more acne prone, just dab that area with the clarifying lotion. These are home remedies and things you can do at home. Now, like I told you, we are all wearing masks. When you wear a mask, it is a synthetic fiber that is there, usually, at least the disposable ones. And please don't use your mask infinitum, which means you need to discard these damn things or wash them if it's washable. I prefer to get the ones that I use, and I just chuck it for the day at the end of the day. Now, the fiber inside can be quite irritating because synthetic. So you could end up having an acne aggravated or initiated by these masks, because you're also sweating in there. It's holding in, a certain amount of vapor that there's condensation on your face. And so it is not the best medium. You know, it's just common sense that if you aerate the face or if you leave things open, it kind of, there's less chance of trapping things under your mask. So when you're home and you think you're safe, just take them off. The one thing you don't want is sit opposite an air conditioner, the draft of which will dry your skin even more and make it look dull. Since we're on the topic of just COVID related stuff, let's move on to what else can be an issue. You could have a true allergy, and the most common form of allergy is known as contact dermatitis. These are conditions which are triggered or activated by certain known things, like agents, substances. Alcohol can trigger it. It could be a new soap you're using. It could be a new cologne you're using. It could be just a sanitizer that accidentally went onto your face. It could be n number of things. So while contact dermatitis looks red and angry, it sometimes might itch. Now, I can't tell you over the video here what to do about it, but if you think it's an issue, it's a problem that you are facing and you need help, then you need to see a professional so they can prescribe something to you. It is generally dry contact dermatitis. You may want to moisten it. Apply a moisturizer on it. It's certainly not a cure, but make you feel better. You can certainly put some lactocalamine on it just to soothe it. Now, one of the things that COVID has also shown us is that you may have a rash, probably because of the fact that you're wearing a mask. If you have a rash, please don't scratch, please don't itch. Wash it. You can use some cold compress on it just to soothe it down. Or again, you can put a bottle of lactic calamine in your fridge and take some lactic calamine and dab it on the areas where you have the rash. Now, one of the other things that you may commonly come across, people refer to things called urticaria. Allergic urticaria, idiopathic urticaria. Idiopathic means nobody really knows what causes the urticaria. Now, even the most seasoned skin specialists would agree that urticaria is really hard to put your finger on what it could be. It could be food related, could be agent related, could be many reasons why. Now, what are the signs? You may get a rash or an itch, any part of the face or body. And if it's a true urticaria, there'll be some swelling, particularly around the eye area. So you treat it like an allergy. If you're looking for something OTC, which is over the counter, you can buy any antihistamine. There are a lot of them in the market, and I don't want to talk about products because I'm not a brand ambassador, nor am I endorsing products. But the most common antihistamines you might see is like the Zines, cetirizine, Allegra, whatever. Make sure that it doesn't make you sleepy, because antihistamines sometimes make you sleepy. So if you take an antihistamine, you shouldn't be driving anywhere. You shouldn't be doing things where you need to be alert, because there's a certain amount of drowsiness associated with it. There are also antihistamines with less sedative properties and will make you less sleepy. So consult a professional if it goes beyond this. I hope the small tips that I gave you will help you, deal with some of the issues that we have. Now, while I was just concluding, it just struck me that I need to talk about the hands as well. Hands can get very, very dry because the sanitizers, most of the sanitizers are alcohol products, very high in alcohol content. So if it gets very dry, if it's not itchy, then you can moisturize it. And I think Vaseline is the cheapest way to get your hands moisturized, provided you don't have a raging contact dermatitis. It's all based on your symptoms. You should think of simple ways to manage your issues. And if you think this is beyond your care and beyond your knowledge pool and something that you are not able to put your finger on, then please seek a professional opinion and deal with it. Lots of luck with your skin. Protect your skin and make sure that you are attended to so it doesn't get any worse. Please stay safe. COVID safe.